All right, I'm Dr. Stefan Paul from Zurich, Switzerland, where we maintain an office in the very center of Zurich, right across from the Opera House, together with my wife Antje and an orthodontist whose name is Thomas Drexler. I graduated in 1985 from the University of Freiburg in Germany. And after going through 2-3 different postgraduate programs, I finally then moved on to the University of Zurich in the prosthodontic department with, at the time, Professor Peter Scherer as the chair. That is where I got my PhD title in the year 2000. And in addition to that, I spent 2 years at the Center for Aesthetic Dentistry at UCLA from 97 till 99. During that period of time, I also got a California dental license. And today, besides the activities in the private office, I continue to maintain a lecturing assignment at the University of Freiburg, Germany, in the Prost department, chaired by Professor Jörg Strupp. In our office, my wife specializes on restorative and implant dentistry and oral surgery. Then we have an orthodontist who primarily uses the Invisalign technique with great success, I have to say. He's probably one of the first-time providers, has treated more than 500 cases, and I'm really impressed how well he combines his pre-prosthetic orthodontic treatment with my restorative treatment, which also concentrates primarily on implant dentistry and complex and comprehensive restorative treatment, which combines filling therapy, fixed partial dentures, aesthetic dentistry, anything that leads to precise approach to a better looking yet functional restoration. Well, recent developments in aesthetic dentistry, to begin with, there's for sure digital shade assessment and communication. That is a field that we use intensively and on a routine daily basis. Means we assess tooth color with digital means and then email that information to the lab technician, who is then in a position using the same software to be in a better level to create the ceramics he needs to. In the posterior sector, we rely on this technique only, and that saves a lot of time, not only for us, but also for our patients. In the anterior sector, however, I have to say that digital shade assessment and communication brings us on a better level to begin with. But for the final touch, if I may say so, it's still needed that the lab technician sees the patient during the try-in and then can adjust the shading according to what was previewed to do. Then another development in aesthetic dentistry, of course, is the ever so interesting zirconia-based restorations. The one thing I can tell you is that we have reduced our use of zirconia-based restorations drastically. There's just one lab technician in Zurich who really, for some unknown reason, at least to me unknown reason, is able to create zirconia-based restorations that do not chip, particularly if it is limited to single crown restorations. So the zirconia hype has a little bit decreased, at least in our office. Then next to that is adhesive cementation techniques. Of course, we still stick to them. There is no all ceramic restorations if you don't use proper application of adhesive cementation techniques. all the one-in-one materials. If I give you that as a generic wrap-up, I still believe you have to be careful with. We stick to the classic approach where you have an etching step, primer application, and then a bonding application, and then you go from there. A more attractive topic right now is digital impression taking. That would be something that would be very helpful and would make life for patients, not only for patients, also for dentists, much easier. However, the bad news is that for now, I think this is still an experimental phase that we are going through. Cost with respect to clinical outcome is not yet at the level that is competitive with respect to the old way doing it, packing two cords and using conventional either polyether impression materials or silicone impression materials. So digital impression taking, I think, is going to be the future, but it is not ready now. Another topic of interest in aesthetic dentistry is the CAD/CAM systems such as CEREC, probably the most widely used system. In my opinion, the CEREC system is a wonderful approach. Just if you compare it to a lab-created inlay, for instance, if we discuss inlay technique, still the design of the interproximal contact area, where basically you should not have just a point or a line, but a surface, convex, concave in between teeth to prevent food impaction. That to me appears still to be something difficult to perform in digital design. I'm sure the CEREC company will improve this approach, and in addition to that, another shortcoming might be the occlusal morphology, which you still have to carve with a burr today. The handmade, lab-created all-ceramic inlay, of course, is a beauty compared to more mechanical approach with the CEREC system. But that is so. In order to summarize the CEREC system, I would say we have opted not to have it in our office because of these shortcomings. Yes, it is less expensive than a lab-made restoration, and the big advantage is that the CEREC system offers to have a one-appointment procedure. No temporization needed, yet for ultimate aesthetics and good functional dentistry, good function, I still prefer to rely on lab-made inlays particularly, but other types of restorations as well. Examine your patient, diagnose your patient, come up with a treatment plan, do some diagnostic wax-ups. This is what is often omitted because of cost. And to be honest with you, we try to explain this to our patients in a very transparent way. Yes, the diagnostics, particularly diagnostic wax-ups, will cost them some money, but it is such a helpful tool in the planning of the final aesthetic and functional outcome that if you have to omit it for financial reasons, this is so a shortcut where you never know where you get out of it. And this is why just doing it according to the textbook, one after the other, according to the rules given in from many down schools, this is the most rewarding approach still today. There is no new material on the market. There is no new adhesive cement on the market. It is just trying to really carefully do it step by step. Now, in implant dentistry, I think what we have seen lately is that the times needed to accomplish proper osseointegration have been reduced due to improved surface design of our implants and surface finish. I think this is science that hardly has begun in our knowledge is very minimal about the surface finish. Has it to be rough? What degree of roughness do we need in order to still improve the speed of osseointegration? In addition to that, a big topic is delayed better than an immediate implant placement technique? In our hands, in my hands, in the anterior maxillary sector, immediate implant placement is so rewarding, particularly when it comes down to perfect soft tissue aesthetics. It just does not compete with any delayed technique, but I understand this is a very controversial topic discussed all over the world in most conferences. And to say the least, 90% of the colleagues in implant dentistry prefer to keep it the safe way, the delayed way, just to not expose themselves to unexpected risks, particularly risk of recession. I'm not soft tissue recession. I'm not talking so much about infection. I think this is problems we have very much overcome so far, but the stability of the soft tissue still is a very strong issue. Now, in addition to that, I think implant design, abutment design has to be reconsidered. If we compare the shapes and sizes that are available on the market today compared to what the morphology of a tooth is. I mean, the average implant has a round diameter, and there is no such tooth in the whole body, in the whole mouth, I may say, which is round. It is deltoid or rectangular. There's all sorts of geometries, but nothing is round. So I think this has to be reconsidered in some way in order to better approach what nature has developed for us to provide better soft tissue stability. Besides that, of course, bone augmentation techniques, hormones, to call it as a generic term, in order to speed up again osseointegration, still a matter of intense research. This just has to be observed over time where this is getting us. When we bring it down to everyday implant placement, I think the biggest step would still be the immediate approach, which is very rewarding yet more risky. I have to admit that. Well, with everything we have discussed so far, we haven't even mentioned occlusion nor temporization, and you may believe, it's not important. Well, yes and no. Probably occlusion particularly, but also a good, if not to say perfect, temporary restoration is the foundation to a good long-term success. That is why everybody probably believes, it's probably not that important. I can do a quick temporary restoration, or I just roughly adjust my occlusion, then the patient will adapt to it. Chipping, in my opinion, originates a lot from less than perfect occlusal adjustment, and I am strongly believing that a yearly occlusal checkup should be a part of recall treatments, just like periodontal recall has established itself all over the world. So be invited to probably find out some practical hints as to how to adjust your occlusion in a practical, fast way. and how to create temporary restorations, again in a practical and very fast way, so that it does make you lose time and rewards ongoing steps, if not to say provides good long-term success for everything you do. Well, personal interest, of course, is my family, the growing 2 children we have, to enjoy their development in school and outside school. And besides that, if I may name the 2 sports I'm into in the summertime, I'm, if not to say, maniac golfer. Whenever there's time to go on the golf course, this is where I try to get away from my microcosmic dentistry into my macrocosmic, nicely adjusted hills and lawns with drives 300 yards probably. Well, I'm not able to do it, but I always strive for it. And in the wintertime, being from Switzerland, of course, skiing, deep powder skiing notably, that is one of the best things you can do with your clothes on.